Today we have Dr. Tehrani, who's founder and director of Aristocrat Plastic Surgery, whose office is in Manhattan and Long Island. Dr. Tehrani is celebrated for his plastic surgery approach, very minimalist. Tell us just a little bit about the practice, how you define your process and your treatment, and how I obviously think you're such an elevated take on everything you do, and it's a very subtle treatment. But I'd love to hear in your own words how you define the practice.
Thank you. Glad to be here, and I think this is really a good thing to talk about different things. In general, I'm a board certified plastic surgeon, so what I do mainly is surgery. Having said that, it's not about making humongous differences in everyone. It's sometimes about the subtle differences, the subtle nuances, even when I do bigger surgeries, in creating nice silhouettes. And overall, what it's about is about making patients feel better about themselves. And that could be sometimes a little bit of Botox. That could be sometimes a little bit of injection in their nose. That could be a little bit of a lip injection. It could be a peel that my esthetician does. So it's, I like to think of us as a kind of a destination for all your aesthetic needs, whether or not being a small improvement or eventually being a big improvement, a mommy makeover or a body lift or everything in between. So, and patients look for that. And I think our patients know that if they have questions, even about things that I don't do, like for example, I don't do hair restoration, but people ask me questions about it, or there are a few things we don't do, but there's things that can come up, and they kind of come to me and say, hey, what do you think of this thing? I'm like, I don't do it, but I think it's a good idea or not. And it's almost like a destination for all of your aesthetic needs.
Amazing, amazing. It's so great to have that range too, because so often you find that people are so specific in plastic surgery or cosmetic dermatology, and they force you down one of those avenues when it might not be the right fit for you. So I think that's so genius about your practice. And then just in looking at the current climate, and there's been so much that we've been hearing about COVID surgeries, and that a lot of people have been going under the knife during this time because the convenience factor of A, you're quarantining, so you're hidden just by virtue of current situation, and B, you have that lovely mask to hide your identity and anything you've done. So are you finding that there's been a rise in people electing to have certain things fixed? And if so, what are those surgeries? And then, what, if any, role does Zoom and having yourself reflected back on you have in that as well?
I think that's a really important point, and it's actually multifaceted. It's been multiple reasons why that's going on. First and foremost, we had a backlog of patients that all wanted to have throughout the quarantine that we rescheduled until we actually opened to be able to do those procedures.
Right.
So the first one was kind of that backlog that we're slowly getting through those patients that were not done during the quarantine. And then on top of that, give it the patients the downtime that they really have, because most people are working from home and can elect to have the downtime either because they're normally going away during a time on vacation and now they're at home vacationing. So they would like to take advantage of that staycation. And also, and I think also, like monetarily, the funds that would have gone towards travel or going away, a lot of people are doing a lot of self-improvement. There's been a rise in self-improvement, healthy, Peloton, house improvement, things that would have gone away and went to different industries have kind of turned around and came to self-improvement. And that's in people's minds and faces. And when you mentioned Zoom, a lot of what we're doing now is online. Used to be just FaceTime, but now Zoom and everything else that goes along with that. And we spend a lot of time looking at ourselves. And there's studies to show that the amount of time that you spend looking at Zoom, like right now, I'm talking, so I'm looking at me. And you guys are doing the same thing. So a lot of times you look at yourself while you're talking, whereas when somebody else is talking, they're looking at themselves, and sometimes the crowd, but not always. And that's actually been studied and proven. So you find faults, and those faults may not be big faults, but even small things that we can mitigate, and we can make people feel better about themselves in real life and in Zoom life.
Amazing, amazing. So are you seeing those kind of those requests for, we're talking predominantly about surgical enhancements, or maybe not, but do you feel like that's manifesting more in a rise in, I understand there's a pent up demand, but maybe, nose jobs, filler, Botox, because people are noticing those features more than anything else?
Definitely, definitely. Noses has been on the rise. Lips have always been on the rise, and people now have the face covering, so they can afford a little bit of swelling during the process of lip filling. So I like subtle improvements when you did like half syringes. Now I'm doing more full syringes because people are like, you know what, I'm going to be in a mask. I'm okay with a little sweat, a bit of swelling. So yeah, definitely a lot of facial procedures. I do a lot of specialty procedures. One of them is a silhouette lift, which is a thread lift of the face. It's kind of like a non-facelift, but it's a facelift. And it's great for people in their early 40s to mid 40s before they really need a facelift. And the biggest problem about it is the fact that for about 3 to 5 days, you have these dimples in your face that mask covers. So I'm doing a lot of that. I'm doing a lot of Y lift, which is kind of like a angle of the jaw elevation to kind of really give your definition to the jaw. It swells for 35 days, and guess what? It's covered on the mask. So things like that are moderately downtime, but not surgical, we do a lot more.
Amazing, amazing. And on that note of necks and chins, so we get a lot of, or we've been hearing a lot of buzz about aging and as it shows in your neck and your knees. So I know that the Y lift sounds super exciting and it's relatively a new development. Talk a little bit about what you would recommend for those people who are pre-facelift or neck lift, and what kind of treatments you feel like are most effective for those two kind of problem spots, especially for women.
I think that there's a lot of good new devices and or procedures available now that do that. The two particular ones that I really enjoy right now are Y lift, which is a kind of an augmentation of the jawline type of lift. So you're getting a lift by, as we age, we kind of lose volume, and part of it is genetic to kind of give definition to a chiseled jawline, and that pulls the neck up. And sometimes I even combine that with a procedure called an elevate, which actually sutures are placed in the neck itself to lift it up. So it's a combination of a Y lift, which is basically a jawline or a mandibular augmentation, and a literal thread lift. Again, not a true facelift or neck lift, but takes 5 years off and lasts 2 to 3 years, which is a really good amount of time.
Yeah.
So that collagen building works really well, and the lifting works really well. So those two newer procedures are really great, and I'm a firm believer something surgical you want to hold off on doing until the time that you really need it. It used to be you turn 50 and you did a facelift, and I think that's too soon, especially with the advances that we've had. If you do a facelift when you're 50, then in your late 50s you're getting another one, in the late 60s you're getting another one, and once that happens, you end up doing too many facelifts in your lifetime and it starts looking funny. So I think trying to do these minimal improvements throughout the process is a better way to go. So like if you start too early, which is late 40s or early 50s, probably a bit early, and then you start, and then you get a need by the time you want to keep refreshed, you end up with 3rd or 4th facelifts, and that's when it starts looking funny. And you want to avoid that, of course, for a natural look.
Completely. And then looking ahead into kind of the fall winter months when we're covered up from the neck down a little bit more, are there procedures that you recommend undertaking kind of at the beginning of the fall season so you can heal and also see the results by the time we're back in season?
Yeah, so the winter months coming before the bikini season are common when I do a lot of body contouring procedures, liposuction, skin tightening like Renuvion, which develops a lot of tightening in the abdominal region, thigh region. You mentioned knees. Before the summer, it's kind of nice to tighten up the knees. There's some threads that you can put in the knees to build collagen. The non-surgical tightening like Fractura, which does microneedling to tighten the skin in that area. Elbows is another area where we can do some skin tightening.
Yes.
Non-surgically. These are kind of like forgotten about areas that bother some people. Hands, you
Yep.
can do a facelift, but your face is looking young. The hand is giving away the age, and we can tighten the hands up. A lot of it has to do with collagen building, whether or not we're collagen building with volume, with biostimulating injections, or with energy, microneedling to provide kind of discrete and on-the-spot skin tightening is different modalities to do it.
Amazing, amazing. And then for the hands, that's another area. Do you recommend typically filler in that?
Initially, for early signs of aging, I like filler because part of it is because you're seeing a lot of veins and you've lost fat volume in the hand. So if that's the case, yes, filler. Otherwise, we need specific fillers that actually build collagen. So you need the skin itself to become thicker effectively. And then we can do radiofrequency or lasers.
Amazing, amazing. And then the concept of fillers that build collagen is super exciting. Are there other advances or procedures or techniques that you're really excited about that are just new to the horizon? I know we covered kind of the neck lift and new advances in threading. Is there anything else that's new?
Well, body contouring has come a really long way. We have really good contouring techniques now with a combination of liposuction and skin tightening. We used to not be able to really sculpt too much because if you remove all the fat, you have all this loose skin that's hanging and it doesn't look good. So now our technology like J-Plasma and Body Tighten is matching it, is able to kind of shrink wrap this new sculpted body with the skin on top of it to be able to get it to be nice and smooth. And so that's come a really long way. And also a bit of a game changer because we never had this before is here we are, we've done all this good work on the skin and the fat, but the muscle is not keeping up today. Even when I do a tummy tuck, you know, with people that had pregnancies, I make the abdominal wall muscles tighter, but I don't make it stronger. So there are newer devices out there. M-Sculpt is the leader in that industry. And what it does, it uses an acoustic wave energy to provide muscle action as though you've done 20,000 sit-ups, for example, and with one session of treatment. So it doesn't replace working out, but you know, like everybody else, whether or not you're going to end up doing 20,000 sit-ups ever is the question. So it's muscle tightening, muscle strengthening to provide definition, either in the abs, biceps, even glutes is a common area that we do to provide elevation after you've done some sculpture. So here we are, like hitting it at different levels. We're hitting the skin, we're hitting the fat for silhouette, and then now we're addressing the muscle to kind of complete the package.
Amazing, amazing. That's super exciting. And then in terms of less invasive options, I know that your Manhattan office at least has some amazing liposuction, or I'm sorry, lymphatic drainage, massages, IV treatments. So talk a little bit about the benefit of those for those who want to kind of baby step into a new them for the new year.
So there's baby steps to get in and also post-surgical steps to take care of what you've done already. So the post-surgical things are lymphatic massage, endomology, cellulite treatments after you've done liposuction. So those are all maintenance and improvement options after surgery. And then before surgery, there's some non-surgical ways of doing cool sculpting for stubborn fat areas. We discussed M-Sculpt for muscle activity. Those are completely non-surgical. There is non-surgical neck tightening like therapy, E-matrix for microneedling, for providing definition to the face and collagen deposition. There's a gamut of different options available throughout those. And that's why it's important to have a consultation either with myself or one of my estheticians and associates to kind of go through the gamut of options available, whether or not it's a small improvement up to something more invasive.